So international patient safety goals, IPSG, uh, it is used to help the accredited organizations address specific areas of concern when it comes to one of the most problematic areas of patient safety. So patient safety awareness uh, was done on 12th to 18th March. Okay, that was the patient safety week. And according to the WHO, World Health Organization, the absence of preventable harm to a patient during the process of healthcare and the reduction of risk of unnecessary harm to the associated with healthcare to an acceptable minimum. Okay, some around some level of harm is always there. Some inherent amount of harm is always there pertaining to any procedures or any care or any activity that is done in a healthcare environment. But to keep it to the bare minimum and reducing it as much as possible, keeping it to the bare minimum, that is the main goal. So, according to World Health Organization 2019 report, around 134 million adverse event happen in hospitals, especially in low and middle income countries, because they are unsafe. They give unsafe care. Okay, and this could result in 2.6 million deaths as well. And the most detrimental errors are related to diagnosis, prescription, and the use of medicine. Okay, so, ensuring patient safety is an ongoing concern for all healthcare providers, as because now it is a fundamental component to the delivery of safe, high quality healthcare as well. So, the IPSG, it was detailed first by the Joint Commission International. Okay, so these six goals was first detailed by the Joint Commission International, and the standards were also given by JCI. And following JCI, a lot of national level accrediting bodies also incorporated these goals. Even in NABH, the same goals are incorporated. Their main focus on the six key areas. These are the six key areas you see, which you see on the slide. And when you ingrain all these six areas in your everyday practice, okay, it makes the hospital more safe, and the providers can improve the patient safety and patient outcomes as well. So goal 1 is identifying the patient correctly. Goal 2, improve effective communication. Goal 3, improve the safety of high alert medication. Goal 4, ensure surgery safety, safe surgery. Goal 5, reduce the risk of healthcare associated infections. And goal 6, reduce the risk of patient harm resulting from falls. Okay, so these are the six main goals of IPSG, International Patient Safety. So coming to goal 1, identifying the patient correctly. Okay, two identifiers should be always used. You should address the name, full name of the patient. Whenever you're calling the patient, address them by their full name. Okay, medical record number has to be kept as well. Okay, before all invasive and diagnostic procedures, uh, whenever you do any invasive or diagnostic procedures, address the person. Uh, I first confirm the patient using their full name, their medical record number, IP number, OP number. Okay, wristbands can also be used for patients to be more correct. Do not use patients' room numbers, bed number, or locations. So, wrong patient errors are very common. Therefore, the purpose of international patient safety is to reliably identify the individual as a person for whom the service or treatment is intended to. Okay, and according to the JCI, as I mentioned, two identifiers has to be used: name or date of birth, name or medical record number. when you start incorporating this, okay, when you do the patient identification, these practices may seem very tough, cumbersome, okay, but in actual fact, patient identification errors can happen in any aspect of the patient's journey, okay, not just at admission or discharge. At any point of the patient's healthcare journey with the hospital, patient identification mistake can happen. So this is the reason why it is very crucial that effective patient identification practices are used every day. Then improving effective communication standards. Okay, especially effective communication when verbally you are giving patient care orders or reporting critical diagnostic results or handing over the patient to someone. Okay, it is very important to ensure that your communication has been understood by the receiver. So share the floor. Everyone should get their time to speak and to be heard of. Don't rush in to put your point across first. Keep focused. Avoid side conversation and stay on the topic. When we are communicating within a group, a healthcare practitioners group is involved in discussing about the patient's condition. Okay, don't talk about something else with someone else. Okay, be focused in the group conversation. Take care of yourself. Do what you need to stay to do to stay focused and be involved. Okay, that is your own task, not to get distracted while a communication is given to you. Embrace the differences. Bring all the different ideas and opinions together. Sometimes the patient themselves will have a completely different idea or opinion of their health. You have to accept them as they see themselves. Respect confidentiality. What is shared should always stay private. Do not share the patient's information. Do not gossip about the patient's situation with someone else outside healthcare. Avoid healthcare speak. Okay, not everyone is a healthcare provider, so don't use medical jargons. Use simple words, simple language to make others understand. Be present. Give your full attention to the work that you and the others are doing. Know your stuff. Do your homework so that you can actively contribute, especially if you're a fresher nurse, or if you're a newly joined nurse, okay, for the first time you have started your career. Okay, you have to sit back and study a bit more to understand. Okay, revise a bit more from your other years as well. Okay, to be fully ready to understand the patient situation. Respect people's time. If you can't make it, let them know. Okay, if you can't be there on time, inform somebody else. Make sure somebody else is there to receive the patient. Improve safety on high alert medication. Whenever the hospital develops and implements the process to manage the safe use of concentrated electrolytes, okay, especially like potassium, um, chloride, phosphate, sodium chloride, magnesium sulfate. Okay, these electrolyte based medications, when they are used, you have to be on high alert. Remove any concentrated electrolytes from the patient care unit to the pharmacy. Okay, whatever concentrated electrolyte store you have in your ward, remove it and let the pharmacy send you the correct medication. All medications in general can be dangerous when they are used inappropriately, but high alert medications, they have a more potential to cause harm that is likely to be more serious when they are given. These are the most common high alert medications. With the mnemonic A pinch, you can remember them. All anti-infectives or antimicrobials, okay, are high alert. It could lead to resistance, antimicrobial resistance, if used inappropriately. Potassium and P stands for potassium and other concentrated electrolytes. When electrolyte based medication or small vials are given. I stands for insulins. If you give the wrong dose of insulin, or you give the wrong dose of insulin to wrong patient, okay, that could be fatal as well. Then narcotics, N stands for narcotics and other sedatives, okay. Then C stands for all cytotoxic drugs, chemotherapy drugs, cytotoxic agents. H stands for heparins and other anticoagulant agents. So hospital should also have a process to place to minimize the confusion about look alike and sound alike medications. The fourth goal is ensuring safe surgery, ensure correct site, correct procedure, correct patient surgery. So, significant patient injury and adverse events can happen if wrong site, wrong procedure, or wrong patient surgery is done. Okay, and these events usually occur because of ineffective communication, lack of processes, lack of patient involvement in the site marking when the patient does not know or does not want to communicate where the surgery has to be done. This is an ongoing concern for hospitals as well. To minimize these adverse events from occurring, hospitals should use multiple strategies to identify the correct patient, correct procedure, and correct staff. Right? All the uh, staffs involved in the surgery, from the scrub nurse to the anesthesiologist and the surgeon, they should be aware of the patient, who the patient is, where the surgery is going to happen, which surgery is going to happen. So awareness should be there. These are the four main identifiers you have to reconfirm 2 to 3 times before you start the surgery. Is it the correct patient? Is it the correct procedure for which they are here? Is the correct side and site? And everyone agreeing that we all are set to go. Use World Health Organization surgical safety checklist. It automatically ticks all these columns. Okay. So it will reduce surgical errors. Then goal 5 is reduce the risk of healthcare associated infections. So effective infection prevention and control practices are very critical to reducing the spread of healthcare associated infection. And this has been a major concern for patients and also healthcare practitioners, particularly over the last 2 years during COVID-19 as well, and COVID-19 pandemic. Focus of the IPSG is on hand hygiene now, majorly, and requires the hospitals to adopt and implement an evidence-based hand hygiene guidelines throughout the hospital to reduce the risk of healthcare associated infections. So hand hygiene, environmental hygiene, screening and cohorting of patients who have the same infection, keeping them together, same infection patients, doing the surveillance, okay, keeping an eye out for signs and symptoms, or to catch the infection as early as possible, taking antibiotic stewardship, following the guidelines of infection control and prevention, having fostering safety culture throughout the hospital. These are the main strategies with which you can prevent healthcare associated infections. Then the last goal is reduce the risk of patient harm resulting from falls. So falls are the cause of a lot of injuries to patient and can occur in both inpatient and even outpatient settings. There, there are multifactorial reasons as to why people are at the risk of falls. For example, some healthcare setting is not correct. Your floors are not correct. It does not have enough friction. Patient history, patient who is admitted because of ENT surgeries, okay, cochlear surgery, okay, patient who do not have complete control over their motor functioning, pediatric patients, okay, some medications, patients who are just coming out of anesthesia, okay, or sedatives, patients who are sedated, visually impaired patients who can't see or who have done eye surgery recently, okay. So So hospitals should have a process of assessing and reassessing the patients for falls risk and implement measures to reduce the fall risk for the patient as well. So these are the implemented measures which you can see on screen. Okay. Putting the patient on yellow wrist tag. Okay, you can see your fall risk tag, which is in yellow color. When a nurse or a caretaker sees this, they understand that this patient is at risk of fall and appropriate measures can be taken, like not putting the bed rails down. Okay. Cot side fall signage can be added like this, or just on the IV stand. Fall sign can be added so that a nurse can understand that this patient is at the risk of falls. Parent education can be done. Wet for floor signages, if work is going on or cleaning work is going on, put the wet for signage like this. Protect vulnerable patients as well, old age patients, eye surgery patients, ENT patients, cochlear surgery patients, patients who have impaired motor function. Okay, so these are the strategies which you can use. So this is the conclusion slide. You can go through the goals once again. So these all are the 6 goals that we have discussed right now. All the courses that we have, if anyone is interested to add more courses, you can add that. You can contact me as well.